Behind every master was once a curious student. Every clinical pearl has been earned through years of trial, error, and evolution. Behind every success are stories, challenges, and a unique journey. I'm Dr. David Norcross, and this is Clinical Curiosities, conversations with specialists, innovators, and experts who help move our industry forward. In this episode of Clinical Curiosities, I'm sitting down with great Joseph Kahn. Joseph is an associate professor at Loma Linda University in California, and he could be known as one of the godfathers of immediacy, especially in the aesthetic zone. I've pulled him away from his busy schedule here at the Nobel Biocare APAC Symposium, where he's just given a phenomenal lecture and presenting some pretty amazing evidence on the regeneration of papillas. I'm very fortunate to be sitting down with him for a brief but very valuable podcast. Okay, so Joseph, thanks for giving us your time. Obviously, I know you've got a busy schedule. We're here at the Nobel Biocare Symposium in Bangkok. Just a little bit of an intro. I don't think you need much introduction to most of our listeners, but you are a specialist prosthodontist in California, a professor at Loma Linda University, globally recognized speaker, someone I came across many years ago on the guide program, someone who sort of started my path in looking at immediate implants. And you're the author of over 140 articles, several of which have been rated as the top articles within our profession. What about the early Joseph? When did you first start being exposed to dental implants?
Well, during my dental school years, actually at that time, dental implants not very popular. It's like a little magic voodoo type of things because a lot of failures and things like that. But it really started hitting on me after my graduation from dental school. And before I went into my specialty training, originally I was thinking about doing not pros. I was thinking about doing like a surgical specialty, like maybe oral surgery or peri or something like that. And one of my mentors in school one day, just out of the blue, asked me, have I ever heard about implants? And at that time, like I say, implants is not really that popular. I say, a little bit, and he told me that, well, the future of implant is really be able to integrate pros, and perio. And because at that time, he told me as a young dental student, he say it's hard to find someone who has passion for both surgery and pros. And he say, I should think about that. So that is the point that really got me started to think about what is implant all about? Why is it taking this combination of peri and pros to integrate it together?
So that was sort of the change from the bone-driven implant placement to sort of biologic and
at that time, not quite yet, but maybe a few years later, people start talking more and more about prosthetic-driven surgeries.
Yeah, and you're obviously most well known for your work on immediate implants.
Okay.
What about the early days of doing that? Was that a little bit rogue? Was it a little bit?
It was difficult.
Boundaries?
I would say pushing the boundaries because as a young clinician, I have no idea about politics.
Yeah.
I'm just curious, okay? And this thing came across, and actually one of my mentors, his name is Peter Worley, was a part-time faculty, at that time. And he kind of mentioned a little bit about immediate, and I still don't know hardly about it, anything about it. But at that time, I'm just curious about it. And so I remember distinctly, I did my first case, and I spent maybe 4 weekends trying to figure out how to do it because there's no literature, nothing out there, right? And then it got me going. And then once I got going, at first I thought, oh, it's great. It get really good results. My patient love it. So I started doing more, and that's when problems started. And there will be some clinicians out there that will just say, boy, you're just a gunslinger. You're out of control. And specifically some implant companies, speakers, they are really against it, Then I realized, whoa, am I stepping into something really bad? But because of curiosity, I keep doing it, okay? Yeah. And of course, I have some failures. And actually, I do not know how the future is going to hold. Yeah. And as you know now, I believe that even the naysayers now are just totally converted for one reason or another. So there's no more controversy on immediate. But back in those days, very complicated.
Yeah. I mean, when I did the guide program, we were given sort of specific safety
sure.
markers to do immediacy. And my background was actually, I came from a practice where the guys had done a lot of immediates, but poorly. And I looked at this technique and went, oh, this doesn't work. This is dangerous.
Absolutely.
It's risky. What I liked about your teaching in Sasha's was, we can do it, but here's, buccal bone must be intact. We must have a decent amount of gingiva. Right. And it sort of got us into that safely, and it was all about case selection.
Absolutely.
But I've noticed now, even guys like yourself and Sasha, you're doing more and more immediacy with even when the buccal plate's gone and things like that. Would you say you've changed over the years?
Oh, absolutely, because it's a journey.
Yeah.
Whatever research I've done, I never truly think I'm there to prove something. It's just a loose step, like a stepping stone. Oh, I did this thing. I realized, okay, I can achieve this. So now let's see what's the next step. Okay, so it's like a little like a journey. So if you look at even the publications, right? I mean, over the 25 years, initially the thinking process much more rudimentary. Now we're able to probably achieve a lot more things, like venture into, oh, maybe buccal bone is not needed anymore, maybe certain things is not needed anymore, and what can we get by? And so, like I say, it's a long drawn out process. The beauty is not like, oh, suddenly let's take some risk. It's a calculated risk, I'm going to say.
Yeah. And what about the technology and the material changes? Obviously the techniques are there, we've changed, we know how to mostly predictably rebuild bone, but do you think the material choices, the newest surfaces, the connections have had big influence, or is it just maybe a little bit?
Great question. Well, the industry will like us wanting to believe that everything they come out is great.
Yeah.
But so what's the reality? If you look back, 20 somewhat years ago, I mean, using implant that is not even, non-platform switching implants, HA-coded surfaces, right? And now I have 20 somewhat years follow-up, and most of the cases are just still working beautifully. So the industry will keep progressing. There'll be always new material, new surfaces. But is it really going to change the equation that much? I'm not sure, because in the end of the day, even with all the digital planning and everything, yes, it's great, but we still need to go back to the fundamentals, right? Yeah. Proper patient selection, proper case selection, proper understanding of biology, right? All those are fundamentals in which is universal. It doesn't change.
Yeah, and I want to touch on a topic that I get asked a lot about in my teachings and things like that, is the socket shield.
Okay? Sure.
Because I've kind of wait around to see what everyone else is doing before I adopt something.
Of course.
It does now seem to be well-accepted technique, but for someone like yourself who's obviously had great results without it, where do you sit? Where's your current thinking on it?
Okay, great question. So there's a lot of controversies on it over the years. Now, probably a little bit better accepted, but still, I would say somewhat controversial. I don't think we can always win over that. Unlike immediate. Immediate is over time, we can convert a lot of people. No matter what, there will be a group of people that's more conservative that they don't want to venture to it. And there's nothing wrong. So socket shield, basically, personally, I have around, this is year number 17, starting 16, 17 years. So I do have some experience. I did some research on it. They do work. Of course, we have some complications too. So how important is it? To put it in a nutshell, socket shield originally published, maybe 17, 18 years ago by people like Hersler. Yeah. And the intention is to keep that buccal bone, right? You leave a fragment of the root on the facial aspect of the tooth to maintain that buccal bone so the content doesn't change. And they do work well. Later on, other researchers start talking about maybe we can extend the shield interproximally. I'm sure you heard about that. Yes. And especially in inter-implant situations. So I've tried both. They both work. However, if you ask me, the question is, how does it compare if you don't do socket shield? I will tell you flat out that on the facial aspect of the tooth, let's say if your intention is to maintain facial contour, I don't think socket shield is really that needed. I mean, yes, it's kind of cool if you do it. It looks great. You know what I mean? You can blow it up 10,000 times and people say, wow, But if you do regular technique, let's say bone grafting, tissue graft like you learn, and I mean, the results are actually very good. Yes, it may not be 100% as perfect as the other one, but 99.999% of patients will never complain. However, at the interproximal aspect, the game changes somewhat, especially in inter-implant situation, because inter-implant situation is not easy to, so let's say if you have a patient that's really picky, papillae is really, you don't want to lose anything, okay? I mean, that the socket should definitely have value on that. So if you ask me, inter-implant situation, frequently, if I look at it, if the situation is indicated, I will start suggesting that to a patient. But facially, a lot of times, it's not needed because it's so technique sensitive, you know what I mean? It takes a lot more work. And then why do I want to leave a rib that, I mean, we probably will be okay, but down the road, there's always, it's just like that. When we place an implant, can we guarantee that implant will never have peri-implantitis? No, there will be a chance. And so when we leave another fragment of the root, can we guarantee that root fragment will never have a problem? I mean, the people who really want to push for it will always say, oh yeah, you should do it. But reality is you add another layer of potential problem down there. So in general, proximally, I think I will go for it. Facially, most of the time, I don't need it.
And what I also wanted to mention is, and one reason I sort of wanted to get you on and love listening to you speak, I think you're always a very entertaining speaker, but also your honesty. I picked out a couple of lines from your Instagram posts, which I thought were fantastic, which was, before judging and criticizing others' work, Joe, please look at yourself or your own work in the mirror. My work is far from perfect. For every nice case I show, there are a few cases that are far from nice. Do you think there's not enough of this said in our industry and on stage?
Yes, I mean, not trying to criticize others, but unfortunately in our world, especially now with social media, everybody wants to show the best because that is going to be your brand. But unfortunately, that's not the reality. So what's my point? I think that we should educate the younger colleagues. I mean, it's part of a core value because medicine is never about how great we did. You know, like in the medical field, if we didn't do good enough, some patients, they pass away.
Yeah.
And sometimes even we try our best, patients still pass away. So same thing in dentistry. I mean, in my opinion, why did I make some of those statements? Because we don't want to mislead the younger generation to think that, oh, you know, I mean, medicine is not, when we look at the doctor sign, you know, you have a doctor, they call me doctor. Why did they call us a doctor? It's not because how proud we can be. Doctor, in my opinion, is a service to the patient. We are the patient's servant.
Yeah.
You know, we are there to relieve their anxiety and pain. And it's not about, oh, how wonderful we can create them to be. You know what I mean? So in a nutshell, I think that to progress our profession in general, regardless specialty, in a very progressive and yet a very, you know, with dignity way, with good core value, we must educate the next generation to be humble, you know, and try to be realistic. Because I don't know about you, I found that the best way to learn is when I look at my mistake or someone's mistake. That's the best educator, is the one that tell me, hey, you know what, I make this mistake, this is what I need to do to try to rectify it. Rather than everything, you just like, oh, we can grow papillae, we can grow everything. So that's more like a fantasy. And in my humble opinion, it's not needed. And the thing is this kind of thing should be contagious. It's not just, it's never about me, about anybody. You know, like you start a fire, he start a fire, everybody start a fire, and next thing is contagious. The young generation realize, hey, you know what? The leaders are telling us that they're not perfect. They can make this kind of mistakes too, you know, and our job is not to convert anybody. Just one person of the crowd feel that way. We've already changed a big, big thing. And that person will share that experience to another person, and that so it's contagious. You know what I mean? Goodness is contagious, I think.
Yeah, I think for me, when I share my failures on Instagram, my inbox lights up. Oh, fair play, well done for sharing this. And I always say, it shouldn't be like that. Like, it's, our profession is not always perfect, and I think we should share. So I commend you for doing that, because I think it is fantastic. And the other line that I picked out, which I thought was great as well, which is, time indeed is my best teacher. It's direct, truthful, and at times brutal. Dare I show what happened 19 years later, refuting what I once taught on stage. So,
but isn't that true?
Have you found that some of your work has been humbling over the years? And
always, every case. I mean, I actually get excited when I see a long-term follow-up. Why? Because they are not so as perfect as before, right? The occlusion, all the perfect occlusion I did, now suddenly a buccal cut fracture off. Why? You know what I mean? I always learn from those kind of things.
Those are the learning experiences, right? When you see that.
And unfortunately, in the real world, most people, they just want to show you the 6 months, you know, oh, my work is perfect, right? Or they show you a beautiful full mouth reconstruction, perfect occlusion, but then they take the pictures before they adjust the occlusion, right? So again, I mean, I think you agree with me, time is our best teacher. Regardless, time is best teacher, not just in dentistry, in anything in life. Sometimes even better than really my own good teacher. And then the only way to realize, to learn about time is only if we look for it. If we don't look for it, time is there, but it will never teach you anything. You know what I mean? So I think time is our best teacher, but only if we search and seek for it.
Well, I'm mindful of the time. I know you obviously want to go out and watch the other great speakers. I'd like to thank you for your time now and your time throughout your career and what you've provided for the profession, for myself, and the influence you've had on everyone. And yeah, thank you very much.
No, thank you for having me here, you know, and I hope that sessions like that will help, especially, you know, to be honest, the younger generations. We're here to inspire them, to guide them, hopefully at the right track, not to just think about fantasy all the time, right?
Yeah.
So thank you.
Pleasure. Thank you.